multiple myeloma is one of those rare cancers. And whenever patients are diagnosed, inevitably, many of them think it's melanoma. And so one of the things I try to educate patients and their caregivers on is simply what myeloma is. So multiple myeloma is an excess protein in the blood, and it's a cancer of the bone marrow plasma cells. And so when we first started treating myeloma, years and years ago, we had very basic diagnostic techniques. So not only now do we have better understanding of the disease, better diagnostic techniques, but better understanding of the drugs that we have to use to treat the cancer. We used to start with just plain old chemotherapies, and now this has evolved into immunotherapy. So imagine the nurse in the 1990s compared to the nurses now, all of the different drugs. I think over 20 drug combinations are listed in the NCCN, or National Comprehensive Cancer Network, guidelines for the management of myeloma. So the learning curve has changed, not only for the nurses, but for the patients and for the outcomes of those that are treated for the disease. Multiple myeloma is a cancer of the bone marrow plasma cells, and it's a chronic condition, not curable for most, but it's highly treatable. Through the evolution of all these new therapies, now we have bispecific antibodies, CAR T-cell therapies, and even the standard therapies such as the anti-CD38s and the other monoclonal antibodies, proteasome inhibitors. We can mix and match all these drug classes to find the right medication for the right patient at the right time to hopefully keep them in remission and living well for a long, long time. And the nurse's role in supporting them throughout their journey is critical to provide education, information, and support throughout.